Welcome to the Pacific Society of Reproductive Health. This is our team here.
Hi, I'm Frances. I'm the Executive Officer. I provide support to the President and the Executive and the members of PSRH.
Hi, my name is Siobhan. I'm an Administrative Assistant for PSRH and I support the work of the board and any projects that we complete, and we have just completed the PEMNET manual and I'm looking forward to any other projects that will be coming forward.
Pacific greetings. Hello everyone. Welcome to the Pacific Society for Reproductive Health. In this short video that we're going to show, we're going to let our members talk about their experiences in the Pacific, the challenges that they face as professionals, you know, the shortage of drugs, the shortage of manpower and all that. But more importantly, they will share with us their learning experiences and what will work for them. Also, we would like to share with you how the Pacific Society for Reproductive Health can actually assist in meeting our members' educational needs. So, let's listen to their stories.
Nogo tiki toko, yes, me too like in trip at the soul. Man, you me sort me now, the buy kai, na bus fare, na school fee, na all kind of something, nothing. You me finish long too, sorry true. I think nobody told them you ask him and pass them, man. First them was one, but you talk Savel or nurse, the ward 11 one. Ward 11 now, Mama said, go sleep now, time we carrying to design. You talk Savel or nurse was tiki like by masking more, yeah.
So that was Professor Glenn Moller doing a walk around Moresby General Hospital with a much younger Kunzi Gowan. So they were too busy to talk to us. So we'll go back and see who can talk to us.
It's 4 to 5 fifths above. People are being indecisive. They're wanting it to be 4 fifths, but it's probably closer to 5 and it's still slightly movable. And she's 7 centimetres dilated. Write that in. She's 4 to 5 fifths above and she's 7 centimetres dilated.
Okay, that was Dr. Miriam O'Connor teaching the EMOC workshop to Samoan midwives, and they were discussing slow progress in labour. Too busy, so therefore we'll have to talk to someone else.
So 1 and 2, 3, and I beg. 1 more. 1, 2, 3, and I beg.
So those were midwives learning how to do neonatal resuscitation. They were too busy, so therefore we'll go and talk to someone else.
Have we got any other things?
Oops! That was the Randskog's manager having her placenta removed by Samoan midwives. They were too busy, so let's go and talk to someone else.
How do you manage someone in your team who really isn't at work today? Okay, who's been very busy and maybe tired and doesn't work as a member of the team when you try and engage that person?
Okay, that was a meeting of midwives sharing ideas in the Pacific sense and facilitated by an Australian midwife. Okay, let's ask someone else because they're too busy.
And Melanesia is, in most countries in Melanesia, are unlikely to meet the MDGs. And because of the size of the population, obviously Papua New Guinea completely overshadows all the other countries in the Pacific. But that's not to say that we should throw up our hands and say, my God, why don't we just go and sit on the beach and drink my lemon milk?
Okay, that was Wame Baravilala talking about MDGs in Melanesia. As you know, most Melanesian countries will not meet the MDGs. But I agree with Wame also that Vailima is a very good drink. But let's go and talk to someone else.
I've learned a lot during the PSRH workshops, meetings, what other countries are doing and what needs to be done, and also the global trend of reproductive health issues.
So is PSRH helping you in your education as well?
Very much, because it was the exposure to PSRH that had motivated me to do my further studies, and I wanted to learn more, to attend to, that is the research workshop and the scan, but I can't split myself in two, so probably I'll have to go with the research.
So now we are on a roll. Mary Mugabe has talked to us about her educational needs. So therefore, we'll now talk to the rest of the members now, and I will come back to you at the end of the video.
I've attended the neonatal resuscitation, the PPH, the emergency obstetrics, and this workshop I really want to attend this scan.
Being a member of PSRH has enabled us to create networking within the Pacific region and also with Australia and New Zealand, and that has actually made us become a family, and we feel not left alone, but we feel like we are part of a bigger family, and it enables us to have that interaction and communication and be able to share ideas, challenges, and successes, and that's the whole joy of being a member of PSRH.
What I like about my work, I guess every day coming to work and at the end of the day just looking at the mothers and seeing the smile on their faces when they go home with their newborns. And I guess it's just the joy of serving the people and the women in the country. The workshop I'll be attending in the PSRH is the ultrasound workshop. I've chosen to do that because I feel that ultrasound scanning in Fiji is limited. At the moment there are only 2 consultants who can do the special scans such as the anomaly scans and TV scans. So I feel that more registrars such as myself, we need to be upskilled in this practice.
It's kind of hard to find the money to pay, especially I came from a very far away, very distant, that is very, very expensive. And it's hard for me to look for money like that. And with PSRH and their support, and that's the biggest issue, is the monetary support, and for me to come all the way here from Palau. I just would like to say thank you, PSRH. If there was no PSRH, I wouldn't even know a lot of people in the Pacific, and I'll be so isolated in Palau that I don't even know what's happening outside of Palau.
PSRH has a very important role in helping us in terms of capacity building, CMEs. That's why it's very important that we have funding for such an occasion as this and for the association itself, because it goes a long way around the Pacific. I will be attending the research workshop, and research is something that is lacking in the Pacific, namely in Solomon Islands as in other countries. And in Solomon Islands we are in the process of doing research, and it's something that we'd like to improve on. So attending PSRH is part of the process of improving and learning how to do research.
Thank you so much to PSRH for being very supportive to Solomon Islanders, and we have the biggest contingent now because it's so popular, and we feel that PSRH really gave nurses and doctors opportunity to learn more on obstetrician and gynecology.
I need to learn the sharing from their own countries. I need to know them, how they practice, so that when I go to my country, maybe I can implement that in my country. I would like to say thank you very much to the PSRH for bringing me all this time to every meeting, because through this meeting we have implemented some of the practice back home, like doing emergency drills to our staff back home, and even implementing some of the practice, like having the PPH kit, the pre-eclampsia kit, that will help us in the future for our staff when we work in our hospital.
I will be attending the health research workshop, and I've chosen that because as a Pacific Island ONG, I need to have some knowledge to do the research in my country to make evidence-based policies.
Managerial-wise and doing administrative work, it's very challenging for me personally. Not so much as clinical-wise. And this is areas I would like to explore just before going home to do some work. Because when you are at home, you are alone, and to run a department when you are alone and no one to help you, it's going to be quite challenging.
I was fortunate to be a recipient of Brian Spirit for Fellowship that has really supported me in terms of just a midwife at that time. I'm now at the level of leadership, the highest, the matron of maternity unit. That has boosted me for the exposure that I had back in 2006. But maybe right now, looking at PSRH as a whole, I think I need to do research in terms of looking at evidence base, and currently I feel at the level of leadership I still need to do research in order to look at what is evidently based and proven to deliver the service back home. I'm looking forward. In the afternoon we are going to showcase some midwifery initiatives, maybe our midwifery tools that we have managed to develop back home during after our attachment in that leadership program in Liverpool.
Now that we have shown you some of our members talking about their educational needs and how PSRH is attempting to address those needs, there are many more voices from across the Pacific, from our midwives and nurses and doctors who are keen to attend meetings and conferences and learn and network with other Pacific professionals. I would like to thank our sponsors. Our sponsors have done wonderfully, have been there for us and been giving us funding that has enabled us and our members to host these workshops and conferences. And I hope our sponsors will be there for us in the future. So before I sign off, let's hear our Kaumatua.
In the Pacific, we need to look at who are the key players of these program areas. The countries are committed. They have the support of the UN agencies as well.
In the Pacific, we start the day with a prayer, and that prayer is an acknowledgement that God is leading us.
Dreams that you dream of, dreams really do come true.